Assalamualaikum and a very good morning. My name is Iman Natasha and my student ID is S55602. Today, I would like to talk to you and tell you on the topic of DID. Some of you might know about a rare illness that few people are aware of, which is dissociative identity disorder and formerly known as multiple personality disorder. Dissociation, the term that underlies the dissociative disorders including DID, lacks a precise, empirical, and generally agreed upon definition. DID is a mental disorder characterized by the maintenance of at least two distinct and relatively enduring personality states. The disorder is accompanied by memory gaps beyond what would be explained by ordinary forgetfulness. So, what is the signs and symptoms about this syndrome? Well, based on my research, the first described case of DID was thought to be by Paracelsus in 1646. Okay, move to the basic signs and symptoms. Signs and symptoms depend on the type of dissociative disorders you have, but may include significant memory loss of specific times, people, and events. Then, out-of-body experiences, such as feeling as though you are watching a movie of yourself. Mental health problems, such as depression, anxiety, and thoughts of suicide. A sense of detachment from your emotions or emotional numbness. And last but not least, a lack of sense of self-identity. For your information, there are three major dissociative disorders defined in the Diagnostic and Statistical Manual of Mental Disorders that published by the American Psychiatric Association. Firstly, dissociative amnesia. The main symptom is difficulty remembering important information about one's self. Dissociative amnesia may surround a particular event such as combat or abuse, or more rarely, information about identity and life history. The onset for an amnesic episode is usually sudden, and an episode can last minutes, hours, days, or rarely months or years. There is no average for each onset or percentage, and a person may experience multiple episodes throughout her life. Second, dissociative identity disorder, formerly known as multiple personality disorder. This disorder is characterized by alternating between multiple identities. A person may feel like one or more voices are trying to take control in their head. Often these identities may have unique names, characteristics, mannerisms, and voices. People with DID will experience gaps in memory of everyday events, personal information, and trauma. Women are more likely to be diagnosed as they more frequently present with acute dissociative symptoms. Men are more likely to deny symptoms and trauma histories and commonly exhibit more violent behavior rather than amnesia or fugue states. This can lead to elevated false negative diagnosis. The last one is depersonalization disorder. This disorder involves ongoing feelings of detachment from actions, feelings, thoughts, and sensations as if they are watching a movie. Sometimes other people and things may feel like people and things in the world around them are unreal, or it called as derealization. A person may experience depersonalization, derealization, or both. Symptoms can last just a matter of moments or return at times over the years. The average onset age is 16, although depersonalization episodes can start anywhere from early to mid-childhood. Less than 20% of people with this disorder start experiencing episodes after the age of 20. In conclusion, this dissociative identity disorder may be avoided given that the majority of people develop dissociative identity disorder as a result of exposure to traumatic events, Prevention for this disorder mainly entails limiting exposure to traumatic events and assisting trauma survivors in coming to terms with what they have been through in a sensible way. That's all from me.